I've always been a very practical person. I love fixing things. I love the anatomy side of what we do. I've had a couple of sports injuries myself as well, so I've been on the other side of knee surgery. So I kind of had an interest in that sort of field, and once I actually got the exposure to it and could see the practical side of it, I really enjoyed it. I think the best part is that the great majority of patients are substantially better off. There's an enormous amount of personal satisfaction going to work, and you meet someone who's struggling in day-to-day life or can't do something functionally, and you can do something to actually help them on the way. And sometimes that can be as little as just some advice to help them achieve a goal, but sometimes it requires surgery, and the great majority of our patients do really well and have really good outcomes. So we're very lucky in this specialty. My practice is, I would say, moderately general. I've always done hips, knees and shoulders, and had a particular interest in all of those large joints. I've done country work in the past, and in doing so, it's really helpful for the general practitioners and the population if you do a bit of general work rather than just being the knee guy or the hip guy. So I've always kept an interest in all those three areas, and my practice has evolved over the years. I've always been based with the Wakefield Clinic, but I've had a big practice in Gawler and the Barossa for years. I've been going there for my entire specialist time. I also consult at Glenelg. The pace isn't as busy as it is in the city and in Gawler, so it's quite refreshing to be able to just pop out of the office and have somewhere else you can go and consult. I personally do most of my surgeries at Memorial, and that's just something that's evolved over the years. Memorial have been very good to me in terms of finding list times that suit me, and for a lot of my patients who do come from that northern Adelaide Gawler area, it's just that little bit closer for them. As the new Calvary's come on board, we've certainly picked up a bit more work here as well, but it's nice to have a bit of a mix of hospitals to work at and give people options. I think we've got a really good group of surgeons, most of whom are extremely well trained. I think they make great clinical decisions, and if there's any difficult or tricky situations, there's always someone in the clinic who's probably had an experience with that, and it's easy just to walk down the corridor, knock on someone's door, show them an X-ray and bounce ideas off people. So we can pretty much cover all bases when it comes to musculoskeletal medicine.